So the HERC team here, based in central Wisconsin, has taken a really innovative, cool approach to solving a difficult problem, which is how do you keep a large healthcare system ready for what may be a very rare event or potentially even a never event? And what they've said is we're going to meet the patients where their needs are, which in this case is in the home. So they've developed a mobile response team that can go into a person's home and evaluate that person for what their risks may be for a highly infectious disease, provide some basic medical care and determine the risk associated with that person and whether they need to be transported to one of the regional treatment centers. So it serves the needs of the community here in a really nice way.
So this discussion really started while working to address a gap in our capabilities in the region. Our hospitals, like many others at the time, really felt that strain, trying to continually keep staff competent, keep them trained in the latest process. And we started with a question back to the Healthcare Coalition. How can we work together on this?
It's really cool that we can bring all these different hospitals and healthcare systems and pre-hospital, public health, everybody comes in together and works really well together. And we find what we need, we get the resources, and everybody pitches in. And it doesn't really matter if you're from Aurora or Theta Care or public health. Everybody walks in and you're part of this team.
So Ebola is a very unique pathogen. We found that when the issue started happening in 2014, that our normal medical PPE and our normal medical practice wasn't working. We needed additional training. So maintaining everyone with that level of training is difficult. So having a specialty team available helps with that. Also being able to potentially see the patient where they are versus bringing them into an environment. So if we're worried about contamination, if they're in their home environment, if we can potentially contaminate a couple of people to go out, do a screening versus bringing them into a healthcare system, an emergency department, a clinic, where we might contaminate multiple victims, multiple patients, and surfaces. We don't want to have to deep clean an entire clinic or emergency department when we could just have it in their house, which is already potentially contaminated.
This is a particular benefit to the children because they're comfortable at home. They have their parents right next to them. They're not in a place that they're, is cold and different like a hospital room. And they're probably going to respond better to us, even though we'll come in kind of some goofy gear. But again, they have their parents there that are going to comfort them. And as children deploy too, knowing how to communicate with kids and explaining everything before we do it, I think it's better if they're in their own home.
We train 3 to 4 times a year and are fortunate to have a fantastic training facility nearby we can partner with for simulated environments to work through scenarios that we would encounter in the community, such as an apartment, a single-story home, or a 2-story home. The home organization supports their member by supporting their training time. This team is funded through federal preparedness grant dollars designated for Ebola. The great part about this team is that we're not just limited to Ebola. We're ready for any emerging infectious disease within our communities.
This team is definitely moving to keep this community safe. They're being proactive, they're thinking things through before anything happens, and I would have the utmost confidence in their ability to keep this community safe.